Where news comes first. This is ABC 7 Extra.
Welcome to ABC 7 Extra Sunday. Good evening, everyone. I'm Mark Ross. El Paso is now dealing with an outbreak of measles. Tonight, we'll talk about the symptoms, why it's important to get the vaccine if you haven't already, and try to clear up some misinformation about this viral disease. Joining me now, El Paso Health Authority, Dr. Hector Ocaranza, and ABC 7 medical contributor, Dr. Okachika Alozi with Sunset West Health. Gentlemen, thank you for coming on Extra tonight. I appreciate it.
Thank you.
Dr. Ocaranza, as we tape this show on Wednesday, how many confirmed cases of measles do we have in El Paso at the moment?
Well, so far we had 21 cases of measles here in El Paso, and we expect that this number is going to continue going up. It is unfortunate because this is something preventable, and that's what we want to tell the public, that they need to not fear the vaccine. They need to be more cautious with the disease.
What is the split between adults and children, and how many of these people were not vaccinated? Interestingly
enough, we have 2 out of 3 of these cases are in adults, which is something very different than what we're seeing in the west part of Texas outbreak, where most of those cases are in children. So we were expecting to see more children, but now we're seeing that it's adults that are getting affected, 18 and over, and most of them are unvaccinated or didn't know whether they had the full vaccination schedule or not.
We were talking off camera about the actual vaccination, that for some people, I'm a child of the late 50s, early 60s. I did not get my measles vaccine until I came back to the United States, so I was a little late to the game. But you're saying that if people have the immunity from that measles shot, if they got it in the 60s, the 70s, the 80s, that they should have enough immunity?
Well, if they only have one shot, they should have some immunity. And with this outbreak that we're seeing, we recommended that if you don't know whether you had the vaccine or not, come and get the vaccine. The recommendation is to know whether you have immunity against measles or not, but one of the things that is quite challenging for the people here in El Paso is, first, many of them, they don't have a primary care physician, and you need an order to go get your blood sample, see if you have antibodies against the measles. So the easiest thing to do is come and get the vaccine. If you don't remember, if you don't know, for those that were born before 1957, they already outlived a lot of people. They outlived many outbreaks, and they don't need the vaccine anymore. But for those that are a little bit younger, definitely, if you don't remember, come and get the vaccine. That's a way that you're going to be protecting yourself and your loved ones.
Dr. Alozi, what causes measles and what are the symptoms?
So, funnily enough, I would have deferred to my pediatrician friend here, right? But as an infectious disease doctor, I can say that it's a virus family called a paramyxovirus, right? So it also, those of you that have heard of human metapneumovirus or RSV, they're all in the same family. And so it's a virus, it's airborne, you cough, it stays in the air about 2 hours, and that's what makes it so contagious, right? I think we've talked about this before. Unlike influenza and RSV and even COVID, that on average affect 1 to 5 people that are not, that we've talked about a lot during COVID especially, measles has an R naught of between 10 and 20. Right? 90% of people that are unvaccinated that come in contact with measles will get measles. And so this is why it's so important to know what it is and how to avoid it.
With a vaccine that's so readily available, is it unusual for a community to see as many cases of measles as we've seen so far this year?
I think that what we're seeing is one of the side effects or the downstream effects of when you pump in hesitancy into a community, right? Whether it's from the political side, the ideological side. Over the last 20 years, we've just had a lot more hesitancy around healthcare, science, and what my mom would just say, good common sense, right? And so as common sense and vaccine hesitancy have kind of trickled into the communities, you're seeing communities that have less than 50% vaccine. In some West Texas communities, North Texas communities actually, they have school districts that have less than 40% vaccine. That's what's driving a lot of this. This is a disease that was essentially called eliminated or eradicated in 2000.
Now, one question that comes to mind is, how can I get the measles if I've already received the vaccine?
I think it's important for people to understand as simply as possible what herd immunity is. Remember, what herd immunity is, when you get to that 90%, it means that only one person in that group of 10, for example, has lack of immunity. So 9 people do have immunity, right? Well, think about it like this. If you now drop that number to 50%, that means 5 out of 10 people can either have measles or get measles. So even if you have the vaccine, whether it's 1 shot or 2 shots, you have a lot more chances of being hit by a virus that your body can't protect yourself against. So I think that's really what's important. So you can get it, but like we talked about during COVID, right? We're not necessarily trying to say that you'll never get this. We want to keep you out of the hospitals. We want to keep you away from the pneumonia, the meningitis effects, the things that can affect people 10 years down the line called SSPE that can leave you brain dead. And so that's the key.
Now, Dr. Okodanzo, this is something we were discussing earlier off camera. Tracking the measles is kind of like tracking COVID for the health department, correct?
That is correct, and that's one of the terms that we learned very well during COVID, the contact tracing. Contact tracing meaning that we're going to be calling you if you have that confirmed case and trying to recall how many places, how many people you got in contact with, especially within 21 days, which is the incubation period. And that's when it gets very tricky. And as Dr. Alosi would mention, since this virus is so infectious, then another thing that we need to tell the public is that some people is going to be infectious even before they show symptoms. So 4 days before they show the symptoms or the rash, 4 days after the onset of the rash, that's when we consider to be the most infectious period. So trying to remember some of those details is going to be challenging, and challenging for us as we try to trace where these people have been, or probably they got their measles, because some of the questions that we get is like, well, where did I get it? Like sometimes we don't even know, because there's so many places that you've been that it could be anywhere, and some people don't even know that they were infectious at that time.
Have you discovered that there's any hesitancy from people about when you ask, can you tell us where you've been in the last 21 days?
Yes, definitely. There's hesitancy because of the distrust that they have into the government agencies and the distrust into the healthcare. Even it is so sad that some people don't even want to go get medical attention. And that's one of the things that happened with a poor child that passed away in New Mexico that didn't even get the medical care. And the medical examiner was the one that determined that this child died of measles.
All right. Still to come here on ABC 7 Extra Sunday, we will continue our discussion about the measles outbreak here in El Paso. Stay with us. You're watching ABC 7 Extra Sunday.